We're going to use upper and lower cervical motion to initially attempt to determine whether or not there's movement limitation in the upper cervical region. And the movement that we're going to demonstrate on this particular video clip is right side bending and left rotation. So again, we'll use the whole neck at first. We're going to ask our patient to do whole neck, upper and lower cervical, right side bending. So Hannah, just have you do this movement several times. As Hannah right side bends her entire neck, if there was limitation in upper cervical left rotation, her end position for this movement would be here. Okay. Next, let's look at left rotation. We're going to position ourselves by the patient's left shoulder, and now we'll use both upper and lower cervical region to look at left rotation. So do that movement several times, Hannah. Her eyes are staying level. That's a good thing. That likely indicates that there's no loss of right side bending in the upper cervical region. If our patient, during left rotation of the entire neck, both upper and lower cervical, demonstrated an end position that looked like this, there may be loss of right side bending in the upper cervical region. So let's test that. Okay? Let's determine whether or not there's pain in the upper cervical region relative to this direction of movement. So we'll have Hannah right side bend, okay, and now left rotate your head upward. And we apply a very gentle overpressure test in the direction of left rotation. This is done slowly, carefully, and we ask whether or not this reproduces any discomfort in the upper cervical region. If so, that's a positive overpressure test indicating a pain impairment in the upper cervical region. Okay. If we want to examine this movement further for motion restriction, again, let's look at this one more time. If right side bending, if the end position looked like this, that might indicate restricted left rotation in the upper cervical region. And if left rotation demonstrated an end position that looked like this, that might indicate limited right side bending in the upper cervical region. Passively, we can test both of those movements with the following two tests. I'm going to stabilize the C1 vertebrae with my right thumb at the posterior arch of C1 on the left side. I'm going to stand to the side and the front of the patient and passively right side bend and left rotate occiput on a stabilized C1. And I want you to actively resist this movement now. If there's limitation in right side bending, left rotation, you'll see virtually and feel virtually no motion occur. Okay. I'm going to drop down one level. I'm now going to stabilize the bilateral lamina of C2, okay, and passively right side bend and left rotate. Hannah's C0, C1, and C1, C2 level. If there were capsular limitation, capsular shortening, limiting this direction of movement, now Hannah, I want you to kind of resist against me now, we'd feel an early firm stop. We wouldn't be able to right side bend, nor would be able to couple left rotation in our upper cervical region. That's one hand contact, and I'll show you one other one in this short video clip. We can passively right side bend and left rotate through the entire upper cervical region. That's both C0, C1 and C1, C2 with this grip here. Again, to repeat, with my right hand, I'm stabilizing the C2 vertebrae in mid position, not allowing C2 to rotate. And when we do that, we're able to isolate this coupled rotation movement to the upper cervical region.